For a business, knowing when a customer will return is important information. In the healthcare sector, I've identified one situation where this has huge consequences. Hello, I'm Sebastian, and I would like to present PreScan, a health AI app designed to predict hospital readmissions. What are hospital readmissions and why are they important to address? Let's say a family member undergoes surgery. If the surgery went well and the patient recovered fully, the insurance company provides full payment to the hospital. But if the patient goes back with complications, the insurance company penalizes the hospital by reducing the payment. If it's less than 30 days, the hospital loses even more money. These hospital readmissions are critical as they cost the US healthcare system $42 billion annually. If we could predict which patient was at risk, doctors can tailor their treatments and reduce readmission costs. PreScan is a tool to help physicians predict these expensive readmissions. The data used to build PreScan comes from a diabetes research study and has 100,000 patient visits over a period of 10 years and is HIPAA compliant. About 50% of the data are readmits and 11% are the critical less than 30-day readmissions. The data has 50 features that can be used to train a machine learning model. There's a 90% chance of missing these less than 30-day readmits, so any prediction tool is very useful in this business case. Here's a quick demo of how PreScan works. A physician will come to this web app and click the risk prediction tool. In a real hospital setting, PreScan will retrieve the patient data from an electronic health record system. The data is accepted and a custom patient dashboard is created. The most important thing for the physician is his risk estimate, along with the probability scores. To help the physician, I provide two charts with simple statistics. The first chart shows the distribution of readmissions for a 70 to 80-year-old Caucasian male patient. And the second chart shows how this cohort of Caucasian men compares to all other 70, 80-year-old males. Both charts indicate that this patient has an elevated risk of being readmitted and needs to be carefully treated. To build a machine learning model, I first had to clean and organize the data using pandas. I split my data set into two categories, less than 30-day readmits and others. I evaluated different supervised machine learning models like logistic regression, random forest, and XGBoost, and chose a logistic regression model. This model had really good accuracy of 80%, but the recall on F1 was low, meaning that it was missing out on catching all of the readmissions. To improve machine learning performance, I explored three aspects related to data and feature engineering. First, I reduced dimensionality of the data set, that is, reducing the number of predictor columns from more than 200 to less than 100. Second, I found that the data was not balanced. The less than 30-day readmits, the red dots, were underrepresented compared to the blue dots. Using a statistical tool called SMOTE, I rebalanced the data by undersampling the larger class of non-readmits. Third, I feature engineered using external information. During exploratory data analysis, I saw that heart disease was a top category in readmitted patients. It's common for drugs to have side effects, so I was curious to see if certain diabetes drugs affected the heart. Supporting my hypothesis, I found research papers that showed that a class of diabetes drugs called sulfonylurea drugs that were commonly prescribed to Medicare patients had heart-related side effects. So I coded these separately and fed them to the model. Now, using a combination of rebalanced classes, reduced dimensionality, and feature engineering, I was able to drastically improve the model's performance. Recall went up 56% and F1 scores by 25%. With this improved model, I built a web app for hospitals using Pandas, MySQL, Scikit-learn, Web2Py, and Plotly. To summarize, I wanted to address the problem of reducing hospital readmissions. For this, I collected patient data and built a supervised machine learning model with a 67% accuracy and increased recall and F1 scores. I then built a prediction tool for physicians to identify patients at risk of readmission and help reduce overall healthcare costs. My name is Sebastian, and I have a PhD in management in the area of strategy and a background in computer science and life sciences. Prior to Insight, I was a strategy consultant for health AI startups in Seattle, and I have previously co-founded a health and bio IT company in New York and led IT and research computing for Silicon Valley biotechs. When I'm not working on data science problems, I enjoy traveling and motorcycling. Thank you.